Hello everyone, welcome to this new video of Bite Size Dentistry. I am Dr. Bhaumit Joshi and today we are going to discuss about the extrinsic muscles and their actions on the eyeball. So if we talk about the extrinsic muscles of the eye, we have 7 muscles: superior rectus, inferior rectus, medial rectus, lateral rectus. So these are the 4 rectus muscles. 2 oblique muscles, that is superior and inferior oblique muscles, and levator palpebrae superioris. And the actions that they cause on the eyeball, there are 6 basic actions. One is elevation, that is superior movement of the eyeball. Then there is depression, that is inferior movement of the eyeball. Then you have adduction. Adduction means medial movement of the eyeball. Abduction means lateral movement of the eyeball. And then we have medial rotation and lateral rotation. Medial rotation is also known as internal rotation or intorsion, which is the upper part of the pupil rotating medially. And then you have the lateral rotation, or what we can call as external rotation or extorsion, which is rotating the upper part of the eyelid laterally. So these are the 6 basic rotations or the actions that we have of the muscles on the eyeball. Now let's see them one by one. First is our superior rectus muscle. Superior rectus muscle causes elevation. Adduction means medial movement and medial rotation of the eyeball. So if you see the ultimate action of this muscle on the eyeball, it is somewhat like this. That is, it has caused movement superiorly and medially. If you see inferior rectus causes depression, adduction and lateral rotation. Now lateral rotation, medial rotation, we are not going to see effect on the position of the eyeball. So we are going to see depression and adduction as a basic effect. So this will cause the medial and inferior movement of the eyeball, that is caused by the inferior rectus. If we talk about the medial and lateral rectus, medial rectus causes medial movement or adduction of the eyeball. So ultimately the eyeball is going to move medially, and the lateral rectus is going to cause lateral movement of the eyeball, that is abduction of the eyeball. Now comes to oblique muscle. Now oblique muscles, that is superior oblique and inferior oblique, are there. In superior oblique causes depression. Remember, superior oblique causes depression and it causes abduction, that is away. So lower and lateral movement is caused by the superior oblique muscle, so it causes lower, inferior and lateral movement. And the inferior oblique muscle, it causes elevation and abduction of the eyeball. So ultimately the eyeball is going to move in this direction. So these are the 6 rectus and oblique muscles which are there. The 7th extrinsic muscle of the eye, that is levator palpebrae superioris, is basically acting on the eyelid. It causes elevation of the upper eyelid. Now let's talk about the nerve supply of this eye muscles. So this extrinsic muscles of the eye nerve supply, you can remember from this mnemonic, that is SO4 LR6 AO3. So SO4 stands for superior oblique, which is supplied by cranial nerve 4, that is our trochlear nerve. The LR6 stands for lateral rectus, being supplied by the abducens nerve, and all the other muscles except for SO and LR are all supplied by cranial nerve 3, that is oculomotor nerve. Okay, that's all from this video. Let me know if you have any doubts in the comment section. Don't forget to subscribe to this channel. Thank you.